First of all, good morning, bonjour. We're in Paris. Can you guys believe this? I know we were just all in a little bit of a theta in the alpha state, so we're going to bring it up to beta state a little bit. So first of all, I want to thank the conference.
You want I do it?
What's that?
You
Oh,
want
that's
to-
okay. I can figure it out. Yeah, thank you. I want to thank the conference for having the 6th edition in Paris. This is my first time in Paris. It's a beautiful city. The food, the people, and the energy is amazing. So thank you guys for coming here. I'd love to see a show of hands. How many of it is your time in Paris? Okay. How about how many people traveled from another country to get here? Okay. Awesome. How many people traveled from another continent to get here? All right. So I want to thank you guys for coming here as a collective, and also the people that are watching this on Zoom. For some of them in their prospective countries, it's 1 a.m. or 2 a.m. in the morning. And so it's amazing when we talk about bringing consciousness together, just bringing people together with commonality. So our commonality is we are all here to serve and help people improve their lives, their quality of life, bring them some vibrancy. And we have a different diverse background of modalities and approaches to get there. And so to me, that energy is spectacular. So I want to thank you guys. So if you guys could just reach the person to left or right, give them a high five and thank you for being here. I appreciate it. Come on. Don't be strangers to each other. We're all community. Okay, thank you for being here. All right. So before we jump into this, as you can see on the screen, I don't know why this isn't playing here. Well, this is supposed to be rotating and look magical. So if you could pretend that spinning around and looks magical, I appreciate that. So as you can see on the screen, it says Dao Needle Therapy, restoring function, stopping pain. And we're going to dive into what that means. But I do want to recognize that, again, we all are coming from a different approach of medicine, and we have our own modalities and techniques. So we will be talking about utilizing needles. I promise you there's going to be a golden nugget in here for some of you. You know, my goal with this technique is it's my passion. It's one of the tools I use, and I use many different tools, but I'm trying to bring more awareness to this system that I've built and put together based off of the backs of many other great practitioners that I've learned from and developed and integrated many systems together. So before we jump into it, a little bit about me. My name is Brian Bowen. I'm from Denver, Colorado, USA. I am a licensed acupuncturist of 23 years and a certified massage therapist of 26 years. Under both of those umbrellas, I learned a lot of different modalities. The reason I bring that up is I love to work with the body and I love to work with the mind. So I also continue my education. I'm a postural alignment specialist, a corrective exercise specialist, certified personal trainer, certified high performance coach, and the founder of course, Dao Needle Therapy. I founded Integrative Health as my main company based in Greenwood Village, Colorado. And we have 24 to 28 different practitioners there. And we have chiropractors, massage therapists, acupuncturists, lasers, nurse practitioners. We do different types of injection therapy. And again, I want to continue to bring that up. I feel like there's many different ways to address certain conditions. And we all have amazing tools that we're here to share, and we all have amazing techniques that we utilize. And in my opinion, we have to be able to look through the lens of other practitioners' eyes to see the body as holistically as possible. And so this is, again, something I'm going to share from my lens that I'm very passionate about. All right, you guys with me? Yep. All right, here we go. So, I love a good intro. Glad the music was on for that. What is Dao Needle Therapy? Oh, there's the spin. Before I jump in, one more thing. 3 housekeeping items. One is this is the first time I've used a handheld mic in a while. Last time it happened, I had I had a small catatonic event where I stared at the screen for about 5 minutes. And I didn't see it for a second. So if I do that and appear to be out in that stratosphere somewhere, if you could walk me off the stage nicely. The other thing is Americans are known to talk loud. And the fact that we have microphones for me is amazing. We also talk fast. I'm going to try to slow it down, but when I get excited about something I'm passionate about, I do tend to talk a little bit faster. So am I talking too fast already?
No, I would remind you.
Well, I got a reminder, just because I like for people to be involved, because the more uncomfortable you are, the more comfortable I am. So if you could give me a whoop. So if I talk too fast, can we practice that together? 1, 2, 3. Whoop. Come on. Whoop. All right. I'm feeling better right now. All right. So the other thing too is, as we go through this, I have a little bit of a callback. Again, we are all here to learn together and grow together. So my callback is this: if I say let's get, I'd love it if you guys could say growing. Okay, so let's practice. Let's get, come on, we're in Paris. One more time, let's get. Okay, all right, feel so much better. All right, Dao Needle Therapy is an advanced orthopedic and sports medicine needling technique. And so it's rooted in and amazing at treating acute pain. It excels at treating chronic pain. Is awesome at treating scar tissue. Now, it does those things, again, by restoring function and stopping pain. We're restoring function to the tissue, but we're optimizing the functional human movement system, okay? So therefore, we're moving through space better. The tissue is in its functional state to where it's optimized. And so that's where it excels. So it's not just about stopping pain, but it's about improving and optimizing the human movement system. Does everybody understand that? Okay. A little bit of history of Dao Needle Therapy. So full disclaimer, I did not invent this needle. This is my customized needle. So Dao Needle is actually the Chinese word for knife. Over here on this side, familiar with that? So once I got introduced to this needle and started to incorporate it into my practice, anytime I asked a patient if I could knife needle them, they looked at me with a little bit of concern and a little bit of curiosity. And so I decided to change the name from knife needle to Dao. My first exposure of this, we're going to go back, not all the way back to Louis XIV's days that I learned Everside the other day, but we're going to go back to 2015. So 2015 was my first exposure from a friend of mine from South Korea. And she lived both in the United States and in South Korea. So, are you familiar with this? Okay. Unfortunately, she got breast cancer and had to have a mastectomy. And she was having a lot of pain, a lot of fascial cording and pain, which is common with having mastectomies. And so she was treating herself. She was an acupuncturist, and she was getting myofascial release, cupping, gua sha, a variety of physical therapies and stuff to help stop the pain. And unfortunately, the pain just stayed consistent. It was a persistent, stubborn pain that stayed there. And so when she went back to South Korea, she ended up going to an acupuncturist there, and then told the acupuncturist all the different things that she was doing. And the acupuncturist says, "Oh, I know, we must do some knife needling." And she, just like everybody else I told you, looked at her with a little bit of caution, a little bit of curiosity, but pain is a motivating factor, okay? And I know, again, we're talking about pain either from a postural strain, stress, or trauma. I know there's many different layers of pain, whether it's spiritual or mental, but this is specific to postural strain, stress, and traumas. And so the acupuncturist performed the technique, and after one treatment, she was 80% better, and after the second treatment, she was 100% better. So she was amazed and stayed in South Korea and studied with that acupuncturist for a while, learning the technique. And luckily for me, she was excited and brought it back and shared it with me. And so after I learned from her, I put the needles up on my shelf and just kind of forgot about them. So they were on my shelf for a little bit. And one day I had a patient of mine, Art, who's no longer with us. He's an amazing human being. He was in my office, and he had been treated by my chiropractors and massage therapists and acupuncture for many years, treating a variety of different injuries and stuff, low back and neck. And so one day he's like, "Brian," he goes, "we've done all these other things, helped my neck, helped my back." He goes, "but I've had this stubborn pain right here for like 10 years. It's really, really deep. That's always just kind of annoying, and we've never really addressed it." So I was embarrassed, first of all, that this was the first time we've really talked about it. And so after palpation, it was deep in the intercostal spaces, and I looked at him and I said, "Art, I've learned this new technique that I've never done on anybody before, and it's called knife needling." And so he looked at me again with a little bit of concern, a little bit of curiosity, and pain is a motivating factor. Like I said, he was like, Brian, I trust you. You can do what you want. So I palpated the area and we mapped out where we are going to needle. And I needled him. And after the first treatment, when he came back, he was 60% better. Second treatment, 80%. Third treatment, gone. And so I was amazed. And so I started just trying to get as much experience as I could. So I started needling as many different people, especially with chronic pain where they've tried a lot of different modalities, right? Have they been through the physical therapy, they've been through chiropractic, they've been through massage, they've done a lot of different stuff. And so I just started having these consistent results of just breaking that stubborn pain cycle. So then it came down to like, well, what age is it? Who is this best for, right? Younger, older, and I started just trying it on a variety of people. And it didn't matter if they were 80 years old or 18 years old, everybody had very positive responses. So after I continued to needle people over and over, what happened is I started looking at the conditions I was treating. And I came to realize, again, based off some of my background, that I was treating a lot of compensations, treating a lot of the branch versus the root when it comes to musculoskeletal pain. And so the needle itself is amazing, but what happens is in some cases we were treating the dysfunction, but in most cases we weren't. So for instance, in Art's case, he had pain in those intercostals on the medial border of the scapula, but he was also kyphotic, okay? So when there's a kyphosis, the ribs push back and it forces the scapula to go out to the side. And so that keeps a constant strain and stress on that tissue and puts stress on the ribs. And so then I had to start applying these other diagnostic and differentiation skills, which we're going to get into and kind of talk about. So within all of our medicines, within all of the things we do, we constantly have to look at, how we can evolve them. Are we treating the root? Are we treating the branch? Are we treating the dysfunctions? Are we treating the compensations? And again, we learn from each other, right? On how to see things with a different set of eyes. So that's a little bit about the history. The anatomy of the needle is different than the common acupuncture needle. So the acupuncture needle, this is still an acupuncture needle. So they're both filiform needles, meaning they're hollow, or they're solid, not hollow, okay? So a hollow needle is what you would use an injection for, and this is a filiform, which is a solid. So it's still a common acupuncture needle with some variations. A common acupuncture needle has more of a cone-tipped shape to it, okay? This has a beveled, chiseled edge to it, which sounds, again, a little concerning, but don't worry, it's not too bad. I have a needle here we're going to demonstrate on everybody before the end of this presentation, so it's fine. Okay, so it's got this beveled, chiseled edge to it instead of that common ballpoint kind of shape to it. The other thing is the common acupuncture needle is about a 36 gauge. This is a 26 gauge. So the 26 gauge, the smaller the gauge, the thicker the needle. But I played around, I have a device I've utilized that you'll see here in a bit that measures mechanical thresholds. And I've played around with different size of gauges of needles to determine how it changes the mechanical threshold, which means a painful spot, which one has the greatest impact. And so what I found is the sweet spot for at least the Dao needle is a 26 gauge needle. It has a different handle than a regular acupuncture, which allows me to utilize different techniques with more precision. So that's a little bit about the difference. So the difference between acupuncture, has everybody had acupuncture in here? Let me see a show of hands if you've had acupuncture. Has anybody had dry needling done? Okay. Has anybody had Dao needling done? Okay. Oh, you're so excited today. So acupuncture, and I know most of you guys already know this, but first of all, it's traditional Chinese medicine, and it's rooted in its own systems theory. So there's all these different concepts that are applied to looking at the meridians and looking at the flow of energy and where there's disharmony. And so you apply these different diagnostics and differentiation skills, such as pulse diagnosis, looking at color, looking at the tongue, the shape and the color of the tongue, listening, and doing a variety of different things. Once you've done that with the patient, then the practitioner discerns, after doing the pulses and all that stuff, where there's more disharmony and how to restore that. Again, we're always looking for the root and we're looking for the branch. Where can we dig a little deeper, right? Where can we uncover some layers? And so once that's been discerned, then the acupuncturist puts those common acupuncture needles into very specific acupuncture points to restore harmony and balance to the flow of chi. Just like in Ayurvedic medicine, a pulse diagnosis, tongue diagnosis, there's a commonality and a tradition that has been shared and just looked at a little bit differently. So they have their own set of systems theories that they look at. So the needles are retained for about 30 minutes on average, and so the patient lays there and relaxes. The dry needling is a regular common acupuncture needle, but instead the diagnostics is more in where there are tight bands, tight fibrous bands that trigger points develop in. Okay, so if you guys are familiar with Janet Travell and the trigger points and stuff, so we're looking at more for trigger points. The needle is inserted, manipulated strongly until you get a muscle fasciculation or twitch response. Okay, and then the needle is pulled back out, so the needle is not retained. Now, that being said, dry needling is that's the start of what dry needling is. It's been transformed a little bit, especially in the US. We don't need too much into that, but it should be an insertion, stimulation, needle comes out. The Dao needle, again, there's no needle retention, meaning the needle doesn't stay in for a period of time. The needle goes in, comes right back out. Now, we have a very specific mapping and grading system and a whole different set of diagnostic and differentiation skills that we apply to those areas. So we're not just looking for one type fibrous band. Again, that's great if it's so specific to a certain muscle band, right? Like a piriformis muscle or a supraspinatus or something. In this case, Dao needling is good for contractile tissue, meaning muscle tissue, and inert tissue, meaning a variety of connective tissues. Is everybody good with their anatomy? Can I use some anatomy language? Okay. So contractile tissue is muscle tissue, inert tissue is connective tissue. So Dao needling is good for both types of tissue. Dry needling is more specific to just contractile tissue. It doesn't have as much of a mechanical influence on the inert tissue. Does that make sense? Okay, and we'll save time for questions. And I know you guys would like to probably utilize the needle on each other. So thank you, Phil. Thank you for the giggles. I appreciate that. So that's just a little bit of the difference between those. Now, Dao Needle Therapy, again, is a specialized style of needle. It's a specialized techniques that are applied, and it's a whole different system. And I'm going to make sure that this is. All right, you guys with me? Do I need a whoop? Am I talking too fast?
No.
Okay, you good? All right, I want to make sure. This is my first time speaking on an international stage here and environment, so I don't know how my pace is. So just maybe whoop me if I need a whoop. Plus, it's fun to hear it. Okay, so the needle the technique, the system, and the practitioner. So again, the needle itself, I can't give enough credit to. I did not design this needle, but I've utilized a variety of techniques over the years, and I've done much research and studies on the impact it has on tender points and restoring function to tissue. And so that needle itself, that specific gauge, that specific tip is just a powerful thing. The techniques applied, there's a rapid peck technique, tap step needling technique, and a probe needling. So a rapid peck is more of the common quick insertion, quick pulling the needle out. And it's done for usually superficial to medial layers of connective tissue or contractile tissue. It's also done a lot for the scalp, so more for scalp needling and for small joints. And again, you guys are probably looking with a little concern at this needle and a little curiosity, and I promise it doesn't hurt that bad. So just in case you're wondering. So the tap step needling is when we're doing the technique when the needle is tapped in, like at different levels. Okay, so you tap it in, tap it in, tap it in. So the reason we're utilizing that technique, first of all, we have a rule to bring tissue to us. So we want to position the body in the most optimal way to access the tissue, because no matter what diagnostic and differentiation skills we're utilizing, unless we bring the tissue to us, unless we're able to access it the best way, we're not hitting the bullseye. So the tap step needling is meant for more deeper tissue and to enter it with more precision and also safety. And then the probe needling actually goes into the tissue and then is manipulated at different angles, really fishing for a lot of adhesions, especially in the fascial layers, the fascial planes, and the contractile tissues. So this is kind of pulsing and using a needle. So that's some of the techniques. The systems, again, we had to start getting a little deeper. Are we treating the root? Are we treating the branch? And so just like Chinese medicine, they have their diagnostics with the pulse and the tongue and Ayurvedic medicine. When we're looking at the musculoskeletal, we have to apply different techniques. And so we go through a variety of things like postural analysis, gait analysis, and functional tests that we're going to talk about. And all of these tests are designed to understand the kinetic chain. Everybody familiar with the kinetic chain? So this is where we start looking, is it a bottom-up approach, top-down approach? So for instance, if my foot turns out to, if my right foot externally rotates, if my toes are pointing that way, right? My hip, my left hip is going to want to follow. So let's say I have low back pain, right? And I needle the low back, but I never correct what's going on. Maybe my right hip, I have a lot of restriction in my right hip and maybe my external rotators. So if my right foot turns out, it could be my right external hip rotators or hypertone. My left hip is rolling forward, but presents as low back pain. So you can have low back pain for many different reasons. So I could needle the low back and I could help restore function, get blood flow and things like that in the area. But if I never understood the kinetic chain and I noticed and found this restriction in the hip, then I never fixed the true dysfunction. So the back in this case is the compensation. And I'll share a couple more examples with that. And so again, that's where it's like, okay, is it strictly just from a strain, stress, or trauma that's more acute? Or has this been a compounding effect for a long period of time? So raise your hand if you've ever just woke up and you've had neck pain or back pain and you're like, oh, I've never had this before. It just came out of nowhere. Anybody? Okay. So usually it doesn't just come out of nowhere unless you were like fell down, right? Usually it's a compounding effect. And where is the only place you ever want to really have a compounding effect? In your bank account, right? Oh, there we go. So that's where we want the compounding effect. So this is where this gets preventative and into long-term corrective care is for you guys to start looking at your own bodies. What deviations do you see in your own bodies? And where is there a compounding effect of erosion taking place? So if something is off just a little bit, then there starts to become compression. Uh-oh. No. Okay. So there starts to become compression. That compression leads to inflammation. Inflammation leads to degenerative changes, arthritic changes, right? So we don't want that kind of compound. We want the good stuff. So the diagnostic and differentiation skills that are applied are to help understand the kinetic chain, to understand what came first, chicken or the egg. And so we start applying these different things. And then one of the big things that we'll talk about is there's a mapping technique that we've established and put together to really help discern that too, and the effectiveness of the treatment. Once we understand the kinetic chain, then we can understand how to position the patient. And so we've become pretty routine with putting somebody in a supine position, meaning laying on their back or prone position. In Dao Needle, we put people in all kinds of crazy positions. So we might have them in a seated position, reaching. Again, we have to follow the rules, bring the tissue to us. How do we get to the right tissue? Think about the difference in pain. Could be, an eighth of an inch, or I don't know in millimeters what that is, but very small, right? And so you have to find in this whole network of mess, right? In this whole thing, where is that impingement? Where is that compression? Where is that inflammation? And so there's a skill and there's an art to that, but we have these other tools that we can utilize to help get us in the most accurate places possible. And so that's what this is designed to do. And you, in your own practice, in your own modalities, probably have your own set of skills and tools that you apply to help really analyze and assess and understand where somebody's at. Once we have the patient in the proper position, then we can pick the right type of techniques for the manipulation. I am a huge fan of integrating passive and active therapies. Raise your hand if you integrate passive and active therapies in your practice. And if you're not sure what that means, passive is, let's say you're working with somebody for stress and you're doing Reiki on them or something, right? That would be more of a passive technique, even though actively, yes, there's energy being exchanged. But what happens when they go home, right? What is the input that's happening to them on a regular basis? I'm a true believer in, like in Chinese medicine, we give people herbs to take when they go home, right? So it's like we do our points here at the office, and then we give them herbs to go home. Keep that momentum going, because our job is to throw water in the fire, put the fire out. But our job is also to help figure out where are they putting a log on the fire? Where are they contributing to stoking this fire, right? And reinforcing a pattern or behavior that doesn't serve them well. And so our job is to do this. And so they have to be actively involved. And so in this case, they might have a corrective exercise that's going to support, where we want to put the body in what position or how we get there. For some of you, it might be, go home after have high blood pressure and stuff, and then, they're going to do more meditative techniques, or sometimes it's mindset work, right? How to put boundaries, in their mind, how to start doing it. So I'm a big fan of integrating those. Now, this client connection and empowerment piece is critical. And I'm a stickler about this, and I teach a lot about this in my coursework, because it doesn't matter what modality any of us are doing. I feel like whether you're in med school, or whether you're a massage therapist, or whether you're teaching breath work, and you're going to any sort of institution to learn this, they should spend the first part before you learn any technique on understanding and really having good client connection. So the ability to listen and to learn and to hear them from a clear lens, and to be able to talk to them in a way that their learning supports their learning style, and what you're doing through the whole process is so important. And the empowerment piece for that patient is huge. So no matter what you're doing, their part, it's their process, it's their body, and they should always be included in that process. And unfortunately, there is a little bit in allopathic medicine, a little void of where that empowerment piece isn't there. Usually the patient is not as much a part of the process in the decision making. And to me, that's not fair. And it's cruel. And so the client connection and empowerment piece, no matter what you're doing through every stage, they are part of it. They can ask questions. They can change directions. They have a choice. You guys with me?
Yes.
Let's get growing. Come on.
Yeah.
Let's do it one more time. Let's get. All right, thank you. Is this embarrassing for you guys? It's embarrassing for me too. Okay, so the finesse. The finesse to me, again, comes with compassion, passion, and reps. And so whatever you're doing, you have to do it with passion, and you have to do it with reps, and it's just practice, and it embodies this connection and empowerment piece. And that's where the finesse comes. And so it doesn't matter what technique or practice you're doing, finesse turns tools into instruments of precision and beauty. So finesse turns your tools into precision, instruments of precision and beauty. So I don't know who quoted that. It's anonymous, so I'm going to take squatters' rights on that. I'm going to claim that for today. All right. So measuring pain. So we're going to be measuring. How many people in here treat musculoskeletal pain?
It's not pain.
So are more, how many practitioners are working more with the mind? Yeah, I know this is hard. Energy. All right.
Yeah.
So obviously they're all intertwined, right? Pain can lead to depression. Pain can lead to decreased energy, poor sleep, all these things, and vice versa. So we're measuring here Assure points / trigger points. An Assure point is a traditional point that's described, that's rooted in Qi and blood stagnation. So in Chinese medicine, when you palpate a muscle or something and there's a tender point, we call that an osho point. So it's rooted more in qi and blood stagnation. A trigger point, again, is developed in a hypertone band of tissue, and that trigger point develops. Now, both of those are rooted in what's called a muscle energy crisis. So if I reach out to all of you and I gently grab your arm and gently squeeze it, now remember, I'm gently squeezing. There's going to slowly be a decrease in blood flow, of energy, qi, of oxygen, of interstitial fluids, of all this stuff. And after about 10 minutes, it's going to get really uncomfortable. You're going to want to kind of like shake me off a little bit. If I held that for 20 minutes, you're going to want to slap me, right? Now, the good news is once I let go of your arm, that qi, that energy is going to start circulating again. The blood's going to start being restored to the tissue. The oxygen is going to start getting exchanged in the tissue, the interstitial fluids move, and you don't have pain anymore. Now, unfortunately, that's not the common thing when there's been trauma, right? Whether it's a muscle tear, strain, postural strain and stress, and just our daily life and activity. And so this is where, again, we have to like figure out what the heck is going on. How do we restore this form and this function to the tissue? So we've applied a grading and mapping to mechanical threshold. So mechanical threshold is when I push, so usually I'm pushing for about 10 pounds of pressure, very slowly into tissue, and I hold for 3 seconds, okay? So depending on how far I get in the tissue, so my goal would be 10 pounds. So if I barely press, and I'm like at 2 pounds, and you're like, oh, that really hurts, that's a very low mechanical threshold. The lower the mechanical threshold, the more imbalance there is, the more stagnation there is, the more energy crisis there is, right, in that tissue. So again, this is where we have to figure out in all of this pain in the body, right? Maybe it's the shoulder. And we start applying this mapping system and understanding and grading this. This helps us discern, again, the chicken or the egg, right? And we're going to get to that just a little bit more. So we're looking for passive and active points. So a passive point is a point that's barely tender, right? It's kind of like, there's something there. An active point is one where you're like, oh my gosh, that really hurts. There's a jump start response, or, that's a very active point. And then there's another one if it refers. So if I push and it refers to a different area of the body, that gives me a lot more information too. And so we're measuring these points. So we're looking at the sensitivity of the point. So that's the mechanical threshold. And then we mark them differently. So we help prioritize them. So a passive point's marked with an O, an active point's an X, and then one that refers has an X with a circle. So if an O goes untreated, it then turns into an X. If an X goes untreated, it then turns into a referral. Now, you can also look at this as phase 1 of pain, phase 2 of pain, and phase 3 of pain. So phase 1 of pain is like, oh, I woke up and my shoulder hurts, and it'll go away. My pain always goes away. And then 3 weeks later, it still hurts. And now it's starting to creep up into your neck, okay? That's a phase 2 of pain. And then phase 3 of pain is when it becomes a lot more chronic. And unfortunately, it starts making changes to our nervous system. And we start to have nervous system smudging, changes at the dorsal horn. And then unfortunately, it becomes the thing you talk about all the time. Like, how are you? Oh, you're not going to believe I've been dealing with this shoulder pain for, and we all know somebody like that. And we don't want them to be like that, right? And they don't want to be like that. So we're looking at sensitivity of points. Then we're going to look at specificity. So specificity is we don't know the parameters of where that dysfunction is. And so this helps us understand that dysfunction and how big of an area or where it's going. So the more chronic something's been there, it's going to have a bigger specificity. It's not going to be just like a little fine area, right? And then the sequence. So picture you have 2 parallel lines. And I've mapped one. Remember the O's, X's, and X's with circles around it. I mapped one, O, O, X, X, O, O. And then my other one is marked X, 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 O, X with a circle around it, X, right? Which one needs to have the most focus? Which one's more dysfunctional, right? The second one. Does that make sense? Got it? Okay. So again, this mapping really helps us figure out where in the body, how do we address, who are we addressing first, okay? So prioritizing dysfunction, compensations, root, and branch. The next slide, I just want to give you guys a warning. the next slide, I'm going to be utilizing a mechanical threshold for testing. This is in 8 times speed. So I'd never palpate this fast, and she looks like she's hyperventilating, but she's totally fine. Okay. Let's get
Growing.
Thank you. I love audience participation. Probably never going to be welcome back to these. Okay. It's really kind of hard to, can you guys see that?
Yeah.
Okay, so these areas are marked. These were not areas of chief complaint for her by any means. There's different colors that are marked differently because we're going to apply different techniques. Then I went over each area that we're going to do techniques, and you can see that chart. And we've applied the mechanical threshold. And so what happens is it measures pounds per square inch. Then I start applying. I just did a lidocaine injection. That's a tracheal injection. This is a regular acupuncture and cupping, and we let those sit for a little bit longer. This is a percussion, and then we're doing a dry needle technique here. And then here we're doing a Dao needle technique. And then here's gua sha. That's the fastest gua sha I've ever done in my life. And long too. And then now go back and we remeasure the mechanical threshold. And what we're looking for is which one had the biggest impact on that mechanical threshold. So ideally, we should be able to push harder. Now we waited 5 minutes before we did this. So when I say immediate, it was 5 minutes after. And we're looking for the greatest change in the mechanical threshold. And in some cases, the mechanical threshold actually got more sensitive. That was actually the ones where we used the gua sha and the percussion. And then some of the other ones barely had a change. And then again, the Dao needle had the greatest impact at almost 2 pounds per square inch. And then after, and that's consistent for doing this many times over and over. And then after we applied those techniques and we remeasured everything, we went back, we waited 15 more minutes, and then we went back and remeasured, and then the same results were used. And so again, this is just a objective tool to see how we are having impact, which one has the greatest impact on restoring function to the tissue. Does that make sense?
Mm-hmm.
Okay. So this next one, let's see here. Dao needling effects on pain. I want to give Dr. Ma a shout out here. He's the American Dry Needling Institute, but he's been an acupuncturist for over 40 years and a neurologist, and has done a lot of research on what actually happens when you put a needle in. And so he's really well known over in Europe and Germany and all kinds of areas.
What's the name?
Dr. Ma. Yeah. And so, but there's lots of other research too about what happens when you put an acupuncture needle in. So some of this is drawn from my studies with him. So Dr. Ma says, I'm going to keep this very simple. When you put a needle in the tissue, it creates a small lesion. Okay. That lesion sends signals to the brain to send a whole cascade of healing events into place. So I always tell my patients when I'm treating them, when they ask from a musculoskeletal perspective, not a traditional Chinese medicine perspective, what happens? What do you actually do? So I explain to them about the muscle energy crisis, and I explain to them that when I put a needle in the tissue, it's creating a small lesion which sends signals to the brain, and the brain starts implementing and sending all this anti-inflammatory soup, right, to the area. And so in a way, you're kind of creating a micro trauma to really jumpstart the healing process. So Dr. Ma says, the more lesions, the better. So I agree with him, but I also agree that a different lesion is better. So as you guys can, remember when I told you about a regular common acupuncture needle, it's a ballpoint pen kind of shape and really thin. And so it goes in really effortlessly into the tissue. So yes, it's still putting a lesion in the tissue, but it's a very tiny one, right? And so when you have chronic pain, a little bit that different one with that edge that the Dao needle has, since puts a bigger lesion in and sends a much bigger signal to the brain that says, hey, let's break this pattern. Let's get going. Let's restart. And again, the precision and the mapping to really do that is a critical piece to it. So when you put a regular common acupuncture needle in, you're moving qi and blood, that's the root of the stagnation of pain. And so when we put a Dao needle in, we're moving a lot more qi. Now there are, okay, cool. So there are mechanical effects that happen. So when a needle is inserted, there's a mechanical disruption into that contractile tissue, inert tissue, and adhesions. And that disruption relaxes muscle tension, right? Breaks up adhesions, gets that chi and blood moving, and starts to allow tissue remodeling to occur. So it is possible not only for you to make changes in your habits that you're doing to create postural changes, but also to have a needling, just like even different techniques with myofascial release to remodel the tissue. So needling has a play with that. It does help with neuromodulation. So when an acupuncture needle is stimulated, or any sort of needle stimulation, it has a direct impact on the sensory neurons, which helps to modulate them. So it helps restore intercellular environment to the neurons. And I can get into that whole thing, so I'm not going to do that right now. It helps support immune modulation. So again, there's a acute localized inflammatory response that stimulates immune cells. Those immune cells then help clean up cellular debris, and it helps to modulate the inflammatory process. So all kinds of yummy things are happening. And then, of course, there's an activation of sensory nerves. And so that activation of sensory nerves creates an analgesic effect, which helps the body send its own endogenous opioids to the area. Does that make sense to everybody? Let's get. Is that wearing out yet? Hey, it's just helping keep me here with you and you here with me. Again, when you're not a needle therapist, this probably isn't super interesting, but I don't know how many people on Zoom are. I mean, for people who don't utilize any needles, is this interesting?
Yes.
Yes.
Okay, thank you. All right. So this next slide is just talking about the kind of recapping some of the systems. So in Dao Needle Therapy, again, the needle is super important. The techniques are critical, but the system behind it is what takes it from, just treating a symptom versus long-term corrective care and understanding that dysfunction versus compensation. So in the foundations, that's where we're doing the grading of the mechanical thresholds. And again, yes, if there's an acute trauma to an area, that's going to be the dysfunction, but sometimes it's the compensations, just like I talked to you about the low back. Level 1, that's where we start looking for more dysfunction, and we're starting to treat excess. So in Chinese medicine, we have to clear excess and tonify deficiency, right? So there's this approach. So we're kind of doing the same thing here. So we're going to apply different diagnostic skills and corrective exercises as well to support our treatment. And then in level 2, we're looking at more deficiencies. How do I support those deficiencies for long-term corrective care? Again, looking for more of that dysfunction. We do incorporate the specialized needle and techniques. We're integrating the mapping and grading system, the postural analysis, gait assessments, and then the functional testing for exercises for, if you guys can see that, for the level 1. And then level 2, we're using neuroproprioceptive response testing. Let's all say that together. Neuroproprioceptive response testing. Manual muscle testing. Has anybody utilized manual muscle testing? I know some people do for applied kinesiology, for actually checking the body for information. This is different. We're looking for muscle strength, right? So more kind of a physical therapy or physiotherapy based approach. And so again, going back to the very beginning on my alphabet soup, these are things that other people have taught me for different systems that I found valued, that I've learned from them to build and incorporate into the system. And this is where the cool creative process happens for all of you. Like, you've learned from great people, and then you have some of your own experiences that then you can add and develop and build the system. So, all of these natural therapies have wisdom from many generations that can be passed on and keep evolving. So I always want to encourage that. Next slide. The foundations is what we're going to get into. And this again is 8 speed. So I do not palpate this fast. This is just an example of kind of the mapping system. So here we're mapping and grading. So we have our X's, our O's, and then our referrals. You'll see me mapping those out. And then we're going to go and needle them. And then after we needle them, then we go back and we recheck. So 90% of the time, those X's are going to go to O's, right? So they're going to decrease. We're going to see a change in the mechanical threshold. And then from there, we feel near or around those points because we don't know the specificity, and we needle one more time. So you can see she's not jumping, and the audio is turned off, so you certainly can't hear her screaming. So position versus condition, I was told I have 5 minutes. So we're gonna go faster through this. That I have this timed out, sorry guys. So law of balance, this is where we're looking at postural assessments. So we're looking at the load joints, at center of gravity. We look for levelness in the shoulders, levelness in the hips, levelness in the knees. We're looking at feet position, is pronation, supination, things turned out, things turned in, any sort of rotations that are occurring, and again, trying to understand the kinetic chain and how they're moving through space under the load of gravity. The next one is we look at the laws of vertical load. And so here we're looking at a plumb line. How are you? We want to be like a sports car, right? Nice and streamlined. We don't want deviations from that. So we want the external malleolus, knee, hip, shoulder, and ear alignment to be nice and straight. Any deviations forward of that, like the computer posture, right? Put strain and stress on one side of the body, and then it becomes this big fight. And then again, our energy doesn't move fluidly, it doesn't move with wu wei through the body. This is just a postural chart, the way I chart, and just some examples of postural deviations. And we don't have time to go through all of those, but you can just see these different variations of postures that you do not want to see. And all of those can present in many different ways of back pain. And then level 1 is treating excess. This one I definitely want to show this slide. This is a diagram that shows what's called the superficial background. So this is how our posterior chain, from more of a personal training perspective, is connected. This center one is actually a dissection. And so it shows how our plantar fascia to our gastrocnemius, to our hamstring, to the sacral tuberous ligament, these are the paraspinal muscles, to our frontalis is one continuous connective chain. And then the picture on the right happens to be the urinary bladder in Chinese medicine. So here we have a future like this dissection and this fascial anatomy, these fascial meridians, 85% of them overlap with the Chinese meridians. So it's really a beautiful thing to see something 4,000 years ago, 5,000 years ago, has this anatomy that wasn't discovered, back then. Here's an example of, I listened to somebody, they told me they had back pain. This is an example. I looked at their posture, and then I wanted to test them to validate my hypothesis. So let's say she had a posterior pelvic tilt, bent knees, low back pain. You can have low back pain from that reason. So we tested her. If her butt could touch the wall, knees were locked out, feet flexed back, she passes. If she can't do that and her butt's way off the wall or she can't straighten her knees, that's a fail. If that fail happens, that helps me validate my hypothesis, position the person in the right position to treat them. And then after we treat them, this becomes their homework. It becomes their take-home exercise. This is checking the inferior line of that. This is checking the superior line of that. So if the butt stays to the heels, head can touch the knees and the ground, that's a great pass. We're looking for roundedness. So again, just stitching all this together for you guys. And then this last slide here is level 2. We're treating the deficiencies, and this is just an example of how we're doing some neuroproprioceptive response testing. Same things apply, right? Sometimes you're not finding something that's excess and you find more that's deficiency. So the needle style changes to help stimulate things. So that is my time. And I'm gonna slow down just for a second. I really want to thank you guys for listening to this, especially non-needle therapists. And hopefully that wasn't a mouthful and brainful of too much information. But if you guys are interested, or if you know needle therapists that are interested, please check out DaoNeedle.com. We have amazing live courses and online courses. And if you happen to have a friend or somebody overseas that wants to have a host a class, I will travel to South Korea to do some needling or whatever. And if you just have any questions or want to connect about natural therapies and different things that you do or what we talked about today, you can contact me at info@DaoNeedle.com. And I appreciate you guys listening today. So thank you.
Thank
Merci.
you.